As a senior that works in the hospital, one of the most basic yet essential skills that everyone needs to know how to do is to take a manual blood pressure. The reason it's so important to know how to do this skill is because having high blood pressure can cause unnecessary stress in your heart and arteries, which can cause you to have a stroke, a heart attack, or it can even kill you. Low blood pressure can also be an issue as well because it can cause you to have inadequate blood flow to your organs. So today I'm going to talk about the various equipment that you need in order to take a blood pressure and actually demonstrate how to take the actual blood pressure. So the two pieces of equipment that you would need in order to actually take the blood pressure is a stethoscope and a sphygmomanometer, also known as a blood pressure cuff. So to begin the skill, what you want to do is you want to place the actual blood pressure cuff on the person's arm. Typically it will be in the person's upper arm. So you need to make sure you put it on nice and tight around the person's arm so when you pump it up, you can get an effective reading. The person also has to relax. Okay. So, after the blood pressure is securely on the person's arm, what you want to do is you're going to put the stethoscope in your ears. And when you're listening for the blood pressure, typically what you want to listen for is you're listening for the first heartbeat, which is considered the systolic pressure. A healthy range for systolic typically ranges between 120 to 90. And the last heartbeat that you will hear is considered the diastolic pressure, and a healthy range for that's between 60 to 80. So what you want to do is you want to put the stethoscope in your ears, and then you want to place it on the person's arm. So you place it just below the blood pressure cuff, and then you'll want to pump the actual blood pressure cuff up between 160 to 180. So I'm going to pump it up to 160 right now because she has a pretty normal blood pressure. So I'm going to slightly let some more air out of the blood pressure cuff now. And so the first heartbeat I heard was at 108, which tells me that her systolic pressure is 108. The last heartbeat I was able to hear was 72, which tells me that her diastolic is 72. So her blood pressure reads as 108 over 72. So today I demonstrate how to take a manual blood pressure. The reason I feel that this is such an important skill for everyone to know is because being able to take a blood pressure allows you to keep track of you and your family's blood pressure, and it allows you to make necessary changes to you and your family's lifestyles that can help mitigate future health issues.